As you know, I'm sure, Congress is back in session today. Earlier this hour, we spoke to Congressman Chris Collins, Republican, New York, about health reform. He says his colleagues are annoyed with how the Senate is handling the bill. Oh, roll tape.
We can work on the replacement piece over the next year and a half. There is plenty of time, but let's get it repealed. Every member of the House is frustrated that our senators are just, frankly, not doing their job.
Our next guest is shocked that a House member should be shocked at the Senate. His name is Senator Pat Toomey, Republican from Pennsylvania, and so it's a pleasure to have you with us.
Thanks for having me, Stuart.
Everybody's saying you haven't got a prayer of getting this done.
Yeah, don't count out Mitch McConnell too quickly. It's difficult, but there's a path to getting this done. I think we're going to have a new version of this bill, which has features that are going to appeal to...
Coming today?
Today or tomorrow, I think, and there will be, for instance, a huge new allocation of funds to fight opioid addiction and other addictions, very appealing to a number of senators who've been holdouts.
Medicaid?
Medicaid, look, we put Medicaid on a sustainable path in this bill, which I think is absolutely essential by just slightly slowing the rate at which it grows, beginning 8 years from now.
But the moderates are saying, that's not good enough, that's not good, you're going to hurt my constituents.
And you know, what's going to happen to their constituents when this program collapses and when we have a fiscal crisis because we refuse to do anything about runaway entitlement programs? That will be much worse. This is a sensible, thoughtful, careful way. Nobody gets thrown off, no draconian cuts, a slower rate of growth.
You've got to do something, haven't you?
Absolutely.
I mean, because it's collapsing.
It's totally collapsing.
You can't really walk away from it by doing nothing.
And despite the fact that the Democrats clearly created this on their own, the fact is we control the government now. And we can't sit there idly while it just collapses. So this bill is an important first step.
Who's going to bend? Is it the moderates who are going to bend, or is it the conservatives who are going to bend?
There's things that can be done for both, right? So, for instance, the opioid funding is something that's very attractive to a lot of the moderates. Some regulatory relief so that we actually have a good shot at seeing lower premiums in a freer market driven by consumers, that will appeal to the conservatives. And I know that staff has been pricing some of those features. So there's a chance to get both sides together for different reasons. But it's not going to be easy.
One of our guests on the program earlier this morning said it's going to go right down to the very last possible minute. And President Trump will jump in right at the last possible minute and pull together something. Does that scenario sound like it's realistic?
I suppose it's possible, but I don't think so. I think, you know, the Senate leadership, Mitch McConnell and his colleagues, as a group of folks working methodically with the people who want on board.
So you put out the new plan today or tomorrow, and it's mulled over, CBO looks at it, and then you expect a vote very quickly.
It may not be as simple as that. The vote could be next week, could be the following week. But my point is that there are changes that we know will appeal to some of the holdouts in each of the two camps.
You're right in the middle of this, aren't you?
I am. I'm in the middle of this.
You're the principal negotiator.
Well, I wouldn't say that.
Votes.
No, but I'm one of the guys that thinks this is an important and constructive first step. Repeal all these taxes, stabilize the individual markets, and put Medicaid on a sustainable path forward. That's progress.
Forgive me for saying it. Yeah. You have to say this. You have to hold out hope that you can do it. You can't come on this program and say, Stuart, not a prayer. It's not going to happen.
Sure I could. I could say, hey, let's talk about tax reform. That's up next. But no, I think we've made a promise. Obamacare is failing miserably. This is a really constructive first step.
Senator Toomey, Republican, Pennsylvania. Thanks for joining us.
Thanks for having me.
Come and see us anytime you like.
Good to see you as always.
And especially come and tell us if you're going to get a vote and it's going to pass.
All right.
I want to be the first
I'll be back. I'll be back.
Sir. Thank you, Senator. Appreciate it.